graft to breast results like?
What are my fat graft to breast results like? It's really interesting because whenever I talk about fat grafting, and this includes women who have told me they want to have fat grafting, and we have 2 pre-op consultations, then I see you again on the day of surgery, minimum of 2 pre-op consultations. And then on the day of surgery, and they'll say to me something like, by the way, how long is it going to last? I think, wow, that's a lot of faith to have got this far. And, there's surgery, there's time out, there's recovery time, there's expenses, all of that. And you think this is anything but a permanent treatment? This is a permanent treatment. So what are results like? They are permanent. They should be permanent. They can be not permanent if they are done technically, I'm going to say incorrectly. If it's done technically, so if it's not permanent, then something's gone wrong at some point. These should be permanent results. So what I tell people is that 70% of the fat graft volume that is grafted should take, I just got a heart there from that lovely lady. 70% of the fat graft volume should take in the long term. So once you've got it, you've got it. It's there. The crucial thing to know about fat grafts, which is different from breast implants, is that fat graft cells, they're living things and they'll respond to your body. So they will shrink and they will grow depending on your weight fluctuations, which means if you lose weight, they'll shrink, and if you gain weight, they'll grow. But people often say, what happens if I lose weight? Do they all die? No, they don't die. They're still there, but they're little. And then if you gain weight, those grafted cells that are still there will enlarge again. They're alive. They're just doing what they would have done wherever they came from. I do a lot of fat grafting. My fat graft take rates, now I haven't formally analysed this, I have to say. My graft take rates seem to be getting better, in that I'm getting more patients afterwards saying they don't really feel that much, if any, has been lost.
Changed,
yeah. And I wouldn't, I've got to say, I'm not going to pin my flag to the mast on that, and I do always say, expect to retain about 7/10. But my graft take rate seems to be getting better. What is definitely objectively improving is my graft volumes. So it used to be that I would graft maybe 100 cc's into a breast, then 150, then 180. I mean, I was fat grafting a breast this afternoon, and she got 300 cc's per side, and I fully expect that to take at least 7/10 of that to take. And the difference is,
So how much is that cup size, that volume?
Well, about 130 to 150 cc's is 1 cup size. So 300 is more than 2 cup sizes.
So you normally, in a consultation, you normally tell people with fat grafting you could get 1 cup size. So she's gonna.
I used to say expect 1 cup size. Then I went on to expect between 1 and 2. And I'm telling people currently expect 1 to 2 cup sizes. And to this, some people don't want much. And if you're if you're going down the fat graft route, it's probably because you don't want that big an increase. But I still will say, look, do you really not, or do you want me just to go all out, just like as much in as I can? And I had that sort of little cheeky conversation with this one just beforehand. I said, look, do you want a cup size, or do you want me to just sort of really do as much as I think I can get in? And she just looked, get as much in as you can. So at that point, I'll do what I call to saturation. And to saturation is where I've got as much fat graft in as I possibly can, and it's starting to exude back out through my cuts. And by the way, fat grafting into the breast, I can do through 2 3mm cuts. One of them will be in the breast crease. You'll struggle to find it, I should hope. And one of them will be at the junction of the nipple and the areola, and the base of the nipple. And you should struggle to find that too. Here's a fun observation for today. So this lady didn't have terribly prominent nipples to start with. They are much more prominent now after the fat grafting. Don't know if that will last, but the pressure of the the increased breast volume seems to just be pushing everything out. So
that's interesting, because a few weeks ago on the Fab Club Live, you were talking about women with gigantomastia and very large breasts, and you were saying that volume can flatten the nipples and can cause.
But yes, but for a different reason, and that's because if you've got ptosis, if you've got droop, so gigantomastia, very enlarged breasts, tends to be associated with breast droop. So if you think about the milk ducts that are attached from the breast to the nipple, these milk ducts are being stretched as much as they can. Now the skin, the surrounding skin, can stretch more than the milk ducts. So the skin stretches and stretches and stretches, and your nipple with it, but these poor milk ducts are hanging on, and they're sort of holding the nipple back. So this nipple gets tethered, and the sort of breast stretches, the nipple gets tethered, and you can get progressively inverted nipples as the breasts enlarge, actually. And that can then be corrected with a breast reduction.